Have you ever checked your blood pressure, seen perfectly normal numbers on the screen, and then just a few minutes later felt dizzy the moment you stood up? Maybe you grabbed the edge of a table, held onto a wall, or even stopped walking because it suddenly felt like the room was spinning. If this has happened to you, you're not alone. Every day, thousands of adults over 50 are told your blood pressure looks normal, yet they continue to experience dizziness, lightheadedness, or the feeling that they might faint. The truth is, a normal blood pressure reading doesn't always mean your body is working the way it should. Sometimes your blood pressure is only telling part of the story. Imagine getting out of bed one morning. You stand up, take 2 or 3 steps toward the bathroom, and suddenly everything feels unsteady. Your vision becomes blurry for a second. Your head feels light, and you instinctively reach for something to stop yourself from falling. Many people assume it's because they stood up too quickly or simply because they're getting older. But what if your body is actually trying to warn you about something important? Stay with me because today I'll explain the 3 most common reasons this happens, why your blood pressure reading may still look completely normal, and most importantly, what you can safely do to reduce these dizzy episodes before they increase your risk of a serious fall. I'm Dr. William Lee, and one of the biggest misconceptions I hear from older adults is, "Doctor, my blood pressure is normal, so why do I still feel dizzy?" It's a great question, and the answer surprises many people. Your blood pressure is not a fixed number throughout the day. It changes every minute depending on whether you're lying down, sitting, standing, walking, eating, or even feeling stressed. A single reading taken while you're sitting comfortably doesn't always show what happens when your body suddenly changes position. Let's start with the first and most common reason. Your blood pressure may be dropping the moment you stand up. Doctors call this orthostatic hypotension, but don't worry about remembering the medical name. All it really means is that your blood pressure falls too quickly when you move from sitting or lying down to standing. Normally, when you stand up, gravity pulls blood toward your legs. Your heart and blood vessels respond within seconds by pushing enough blood back up to your brain. But as we get older, this response can become slower. For a few moments, your brain may receive slightly less blood than it needs, and that's when you feel dizzy, weak, or like you might faint. And the good news is that there are simple things you can do that often help. Instead of jumping out of bed, sit on the edge of the bed for about 30 seconds, move your feet up and down a few times, take a couple of slow, deep breaths, and then stand up gradually. These small movements give your body extra time to adjust and help your circulation catch up before you begin walking. It sounds simple, but many of my older patients notice a real difference after making this one. Small change. Now I'd like to ask you something. When do you feel dizzy most often? Is it when you get out of bed in the morning, after sitting for a long time, or while walking around the house? Let me know in the comments because your experience may help someone else realize they're not alone. But here's something even more surprising. What if the dizziness isn't caused by your blood pressure dropping naturally at all? What if the medication you're taking to protect your heart is actually causing your blood pressure to fall a little too much at certain times of the day? This is more common than many people realize. Now let's talk about something that surprises many people over 50. Sometimes the dizziness isn't caused by your blood pressure condition itself, it's caused by the treatment. Please don't misunderstand me. Blood pressure medications save lives and help reduce the risk of heart attacks and strokes, but in some people, especially older adults, the medication may lower blood pressure a little more than the body can comfortably handle at certain times of the day. For example, imagine you take your blood pressure medication in the morning, skip breakfast because you're busy, and then spend a few hours doing household chores or walking outside. Your blood pressure may fall lower than usual, leaving you feeling weak, lightheaded, or unsteady. This doesn't necessarily mean your medication is wrong, but it does mean it's worth discussing these symptoms with your doctor. Never stop or reduce your medication on your own. Instead, keep a record of when the dizziness happens, what your blood pressure reading was, and whether it occurred before or after taking your medication. That information can help your healthcare provider decide if any adjustments are needed. The next common cause is something many people overlook: dehydration. As we age, our sense of thirst naturally becomes weaker. Many older adults simply don't feel thirsty. Even when their bodies need more fluids, mild dehydration can reduce the amount of blood circulating through your body, making it harder for your heart to maintain stable blood pressure when you stand up. The solution is often simple but very effective. Unless your doctor has advised you to limit fluids because of a medical condition such as heart failure or kidney disease, try drinking water regularly throughout the day instead of waiting until you feel thirsty. Eating water-rich foods like cucumbers, oranges, berries, or soups can also help support healthy hydration. These small habits may reduce dizziness and improve your overall energy. There's another mistake I see quite often. Many people check their blood pressure only once while sitting comfortably and assume everything is fine. But if you feel dizzy after standing, it's helpful to measure your blood pressure both while sitting and again about 1 to 3 minutes after standing, following your doctor's instructions. Sometimes that comparison provides important information that a single reading cannot. Before we move next, I want you to remember one important message. Dizziness should never be dismissed as just getting older. It may have a simple explanation, but it always deserves attention, especially if it happens repeatedly or increases your risk of falling. Before we finish, let me leave you with one reassuring thought. Feeling dizzy, even though your blood pressure looks normal, does not automatically mean something serious is wrong. In many cases, identifying the real cause early and making a few simple daily changes can significantly reduce these episodes and help you feel more confident on your feet again. Here's a simple routine I often recommend. When you wake up, don't rush out of bed. Sit on the edge of the bed for about 30 seconds, gently move your feet and ankles, take a few slow, deep breaths, and then stand up gradually. Stay well hydrated throughout the day, avoid skipping meals, and if you take blood pressure medication, never change the dose without speaking to your healthcare provider first. These small habits may seem simple, but they can make a meaningful difference over time. However, there are certain warning signs you should never ignore. If your dizziness is accompanied by chest pain, severe shortness of breath, sudden weakness on one side of the body, difficulty speaking, loss of consciousness, or repeated falls, seek emergency medical care immediately. These symptoms may indicate a serious medical condition that requires urgent treatment. Before you go, I'd love to hear from you. How old are you, and when do you usually feel dizzy? After getting out of bed, standing up from a chair, or while walking? Share your experience in the comments because your story may help someone else who is going through the same thing. If you found this video helpful, please give it a like, subscribe to Health Insight Daily, and share this video with a friend or family member who often feels dizzy despite having normal blood pressure. Thank you for watching. Stay healthy, stay active, and I'll see you in the next video.